Hello everyone. This mini lecture is on Zhong Yi Qi Tang, also known as tonify the middle and augment the qi decoction. The formula is from the Cal formula list. I will summarize the pattern, a short patient case, 3 clinically important drug-herb interactions, and a practical management plan. Traditional use. Zhong Yi Qi Tang belongs to the category Tonify Qi, or Raise Yang. The formula is selected by pattern, not just by disease name. In this presentation, the goal is not to prove that herbs replace medication. The goal is to show how a practitioner thinks about benefit, risk, and communication with the patient's physician. Case patient. 55-year-old male with fatigue, loose stool, mild organ prolapse sensation, rheumatoid arthritis, and diabetes. Medicines. Methotrexate, prednisone, and insulin glargine. The pattern diagnosis is spleen qi deficiency with sinking of middle qi. Tongue pale with teeth marks. Pulse weak. This gives a reason to consider the formula, but it also creates the need to check her or his medication list before recommending treatment. Interaction 1. Huang qi and immunosuppressants. Mechanism. Astragalus can stimulate immune activity and may oppose immunosuppressive therapy. Clinical significance. Moderate to high in autoimmune disease or transplant patients. Management. Identify high-risk patients, avoid duplicate herbs, and monitor symptoms and objective values when relevant. Interaction 2. Ren-shen and insulin. Mechanism. Ginseng may lower blood glucose and add to insulin or sulfonylurea effects. Clinical significance. Moderate. Hypoglycemia is possible. Management. Counsel the patient on warning signs and coordinate with the prescribing clinician if the medication has a narrow safety margin. Interaction 3. Gankao and prednisone or BP risk. Mechanism. Licorice may worsen sodium retention, potassium loss, edema, and blood pressure. Clinical significance. Moderate to high with steroids or hypertension. This interaction may be less certain than the first one, but uncertainty is still important because patient safety comes first. Management plan. Coordinate with physician, monitor glucose, BP, edema, and potassium symptoms, avoid acute fever, and reassess autoimmune activity and fatigue after a short trial. I would also document the formula, dose, product brand, start date, stop date, and all current medications. If red flags appear, the formula should be stopped, and the patient should contact the physician. Conclusion. Zhong Yi Qi Tang may be useful when the pattern fits, but the safest clinical approach is a short monitored trial, clear patient education, and communication with the physician and pharmacist. Thank you.